At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Digestive Disorders, the Gluten Connection and Immune Response on Wednesday, July 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. Welcome to Dr. Tom Roselle Live and the heat wave that we have in our mid-Atlantic area, and actually outside this area of the world as well. So kind of, take it easy. Make sure you stay really, really hydrated, because if you don't, you're in trouble. Let me give you a little tip on how to make that happen. Take a little, either pink salt or take some Celtic salt, and maybe about, a third to a half a teaspoonful of it, and make sure you sprinkle it in your water and on your food. Don't cook with it, just sprinkle it so you're getting that much in you, and you'll find that you'll hold that water into the tissues and you won't feel as exhausted, as drained out and so forth. But be really, really careful with this weather. We're not used to it on an ongoing basis, and it can drop you. So back it down just a little bit, relax, make sure you're getting a lot of fluid. And I don't mean coffee, because that's going to dehydrate you even more. I don't mean sodas, because that'll do the same thing. It's got to be plain old water. And you can take a little lemon, put the lemon in the water, put a little sea salt in the water, and drink that. If you have to, go get some pure honey and maybe a half a teaspoon in there to give you a little bit of a taste, but you got to have it. And because if you go out and you get dehydrated in this, you're going to feel ugly. I'm telling you, it's not going to be fun. So be careful. We're going to get into a program today that I think is long overdue. And it is the teaser, if you will, for a program that I'm going to be doing on Wednesday, July the 10th at 6 p.m. at the Roselle Center for Healing in Fairfax. We're going to talk about digestive disorders. We're going to talk about the gluten connection, and we're going to talk about your immune system, but we're going to expand that in talking about your neurological connection. And today's program is basically, we're talking about the brain and the gut, or the intestinal tract, the second brain. And we're going to walk through that a little bit. But first, you got to know what it's all about. And I want you to know that if you understand and support this one part of your body, and by the way, where does the gut start? It starts in your mouth, and it goes all the way down to the exit point in the lower part of your body. And all of those things are super important of how you function, how your immune system works, and how your brain functions, and your neural connections, and your inflammatory reactions, and all that. So pay attention, take notes, and we'll probably, touch on areas that you say, wow, I didn't know that. Maybe I heard about it, but I wasn't sure. But over the next couple of weeks or so, we're going to be getting that in a very, very specific place for you, meaning that you're going to understand it, you're going to get it, you're going to know what to do with it. And, just think, if you have pain, or if your brain's foggy, or your joints are sore, or your immune system is breaking down, or you have rashes all over your body and so forth, could it be coming from your gut? Yep, absolutely. And this whole gluten thing, we're going to talk about that intimately. And we're going to tell you about the different proteins that are associated with gluten associated with certain proteins, and how damaging it really can be over a period of time. In this country, we've seen an advancement in disease presentations. I kind of use that term, right? Advancement in disease presentation. Well, yeah, we really have. Since I was very young, people were not as sick. If you go back and you look on the internet and Facebook, and you look at kids that are the 18, 19-year-olds, 17-year-olds, 16-year-olds, 20-year-olds, we have an overfat society, and that's just one of the problems. But more importantly, people were not as sick chronically as they are today. And that's a subject that we're going to expand on as we go through, and why this is so critically important to you. But let's start with this gut-brain connected piece of information and what that's all about. First, I want you to think about this. That intestinal tract of yours is stimulated by some things that happen before that. And that something that happens before that is you're chewing of your food, you're developing saliva, and then you swallow it. It triggers your stomach to produce hydrochloric acid, which is going to break down your food and create what's called an acid bolus, bolus, bolus. It goes into the upper part of the small intestine and it triggers the release of other enzymes. What are those enzymes? Your gallbladder juices, it gets your liver to work a little differently, it stimulates peristalsis. But you know this thing right now that's out there and they're calling, I think it's EPI or exocrine pancreatic insufficiency. Well, we've known about that forever, and it happens for a lot of reasons. One, it can happen because you're not producing enough hydrochloric acid in your stomach because that triggers the pancreas to work. And that's number one. Number two, the nerves that go to that area are not firing properly, so that organ can't work the way it's supposed to. Three, that system is overworked, it's beat up. Why? Because it's the same organ system that produces insulin for you to transport blood sugar. Remember, I started the program by talking about we're over fat? No, that was my suggestion. And part of that is because we don't break foods down, and we'll talk about why that's the thing. But as we go through, we're going to talk about this intestinal tract, gut brain, or the second brain. And that's what I want you to remember, that the whole neurological system stems from the production of certain chemistries, neurochemistries that start in your gut. It's called the neurotransmitters. So then we have that, and then we have, this connection that goes on. See, if you look at your intestinal tract, kind of cut it, cross section, what you're going to see is all these little hair fibers that are there. They're called cilia, C-I-L-A, and they increase the absorption level of your body so you can bring things in and so forth. The intestinal system also looks like a colander. You know how you get the water out of your pasta and your rice and things like that? Well, they have these little tiny holes, and these gates, if you will, are protected by something called zonulin. And when that's not there, you absorb things way too fast. So just kind of keep that in the back of your mind. And I promise you we'll get into a little bit more of that connection, over time and what that really means. But the gut and the brain are connected through these chemicals that I just talked about called neurotransmitters. The neurotransmitters that are produced in the brain control feelings and emotion. Now, we're going to get into that as well. And by the way, join me after we leave this and go to drtomroselle.com, and we're going to talk about the emotional connection to the intestinal tract and why that gut feeling really exists, that human gut, your intestinal system. It contains 500 million neurons, and they're connected to the brain through different nerves. And the main one, the biggest one that is connected through, is something called the vagus nerve. So we're going to talk about that and how it works. And it's really important that you understand this, because this all by itself can give you everything that you need to know about keeping your body's immunological system strong. And it's not about vaccines, trust me. It's not about any of those things that, they kind of talk to you about on television and rattle and say, you got to do this, you got to do that. You remember the vaccines, you remember COVID? Yeah, well, yeah, something like that. So we're going to talk about why that intestinal system gets inflamed, how the immune system is part of the gut-brain axis, and we have to understand that it's regulated by something called your gut bacteria, and those things are called your microbiome. And there's really good guys, and there's some guys that are bad. And you don't want them to get inside your bloodstream, because what happens is they cause a tremendous inflammatory reaction. There was a cool publication, and goes back about 5 years ago, 2020, and it was published in a journal called Frontiers in Immunology. And it suggested that the imbalance, when you hear when I hear the term, and when you hear the term out of my mouth, dysbiosis, that simply means there's an imbalance that occurs in that intestinal system, in your good and bad microbiome, because they're a symbiotic relationship. They keep each other in check. So, and when there's this imbalance, this dysbiosis, it alters the integrity, if you will, of this gut-brain barrier, contributing to these inflammatory reactions. And guess where it can affect before it affects any place else? It's called your brain. And these inflammatory pathways have been linked to inflammation that happens in the brain and the spinal cord, including things like MS, multiple sclerosis, Alzheimer's, Parkinson's disease, as well as allowing you to experience anxiety and depressive types of disorders. Why? Going back to what I just talked to you about, that it produces all of those neurotransmitters. So when you understand that, and that might be a possibility, wouldn't it be great to find out what you can do about it, and why sometimes you have spinal pain and joint pain and major headaches and so forth, and you can't figure out why? But we keep throwing drugs on top of it. It really doesn't do much. And then all of a sudden you get this rebound phenomena. And what does that mean? When you get a rebound phenomena, that means it seems to be worse than the original symptom. And that's what happens when you take medication. It suppresses your body's immunological responses subsequently. When you're not on those drugs anymore, it's there, and you pay a price, and it's pretty ugly. We're going to talk about that vagus nerve connection from the brain to the rest of you. The vagus is it is the largest nerve in the body. It's the largest connecting nerve to the gastrointestinal tract. And there's a whole bunch of information that, I would think that smart people need to be looking at, and why, when it's not working the way it's supposed to, you may have things like irritable bowel syndrome and irritable bowel disease and inflammatory bowel disease and, hyper irritation due to allergy reactions in the system and so forth. So the gut and the brain communicate, again, revisiting what I just said, through these chemicals, these neurotransmitters. And these neurotransmitters are produced in two places. They're produced in the brain. Everybody said, yeah, I understand that. But that's not where the majority of them are produced. They're produced in the gut, and they kind of go back and forth and communicate. And they regulate your emotions. You have things like serotonin and dopamine and GABA and things like that kind of bring you down a little bit and get you under control. So the gut-brain axis is critical when it comes to emotional and mental health. And yet we sabotage ourselves on a day-to-day basis, ongoing. So we have to really understand it if we really want to help ourselves. So in this paper, that I just alluded to a little while ago, the microbiome, these good bacteria and the bad bacteria, they are directly related to somebody's mental health. And the people who are suffering from old age dementia, Alzheimer's, Parkinson's, what I mentioned before, sometimes it's nothing more than that microbiome not working the way it's supposed to. You go through, I said 2020, now we have another paper that came out after that and was published in Pharmacological Research, of all places in the world, right? That was 2021. And in that paper under Pharmacological Research, they suggested that poor intestinal health may contribute to the onset and progression of mental health issues and conditions, including severe depression. Now, if you study a lot of the drugs that are out there right now that are working and different, they're either blocking certain transmission or they are suppressing certain transmission. And they work a little differently, but the effect is that they are artificially altering the expression and experience of what's called your emotional state. So that's why we have that gut-brain phenomena. If you've lost your motivation, your get up and go, often it's the intestinal tract. Actually, more often than not, it's the intestinal system not producing something called dopamine. Dopamine is the prime mover. It's what makes you shake and move and want to get up and go do things. When dopamine's not there and it's not working the way it's supposed to, guess what happens? You end up in a really bad emotional place. You don't want to do anything, and so forth and so on. The second part of the program, when we go into the live stream, Ageless Health live stream, this immediately after our program today on WMAL, we're going to talk about feelings and how they're connected to all those things. We're going to talk about, how they actually manifest. Wouldn't that be great to know? And then as we go through the next couple of weeks, we're going to talk about why people get in such pain, how it really affects the body, and why we're self-sabotaging ourselves through dietary choices, neurological implications, meaning we're putting up with the lack of neurological transmission in the body the way it was meant to be, the way your body was designed to have it that way. And if you really get it, maybe, just maybe, my goal, my dream is to get you motivated so you do what's necessary to fix you. Do you know if your gut's working the way it's supposed to, you live longer? If your gut's working the way it's supposed to, your skin looks better. You don't have the blotchiness. You don't have the rashes. You don't have all that nonsense that shows up all the time. So wouldn't it be great to really understand more about that and make it happen? I think so. Did you know your gut has a direct input to thyroid function? Did you know that any fungal or yeast problems that you have can stem from an overgrowth that permeates the wall of the intestinal system? You know, those toenails that you get that sometimes show up with a lot of mold? That's not just something that you get because you walked into a wet shower someplace. It's because your body, your physiology, your cellular responses said, okay, I'm ready. Let's get it done. But and you start growing these things. So to treat that permanently, you got to treat you. But here's what I want you to remember as we go through. These neurotransmitters that are produced, as I said, in your intestinal tract, that when they're not balanced properly, you can have swelling, you can have headaches, you can have loss of vision, you can have joint space pain and so forth. You're going to age much more rapidly than you would otherwise. The neurotransmitters have found that there are things that are, like norepinephrine and epinephrine and dopamine and serotonin. We mentioned a couple of those before. And they're able to regulate and control blood flow, and it affects your bowel movement. So those of you who've been like over the top, super constipated for a long time, and you might have a bowel movement every 3-4 days. Some of you, once a week. Some of you much longer than that. Years ago, I taught a class on immune function and so forth, and there was a young woman in the back of the room, and I said, how many of you have a bowel movement every day? Some hands went up. How about every other day? How about once a week? Well, this woman didn't have a bowel movement except maybe once every 3 weeks or so. And I just looked at her. Anyway, there's a whole story that if you come to the class, I'll tell you about it that night. It was an interesting eye-opening experience for this young girl, but something that shouldn't have even happened to begin with, but it's resolvable. But you have to take control as well, and you have to make sure you understand it. So on the 10th, Wednesday, July, 6 p.m. at the Roselle Center for Healing, I want to encourage you to join me. I'm going to be the presenter on that program. Just me, little old me. I'm going to be doing that. I'm going to give you as much data as you want. I'm going to, show you how this stuff works. I'm taking a program that I normally do for functional medical doctors and other healthcare professionals in my world. And I'm going to show you so you can understand it and apply it, how it actually works. We're going to talk about the few, nutrition corrections and things that you can do. But wouldn't it be great? Wouldn't it be wonderful if you could reverse a lot of things by just changing a few things? Wouldn't it be great if you can get rid of some chronic problems by understanding that you actually have control over it? I don't know about you, but that's one of the reasons I keep on keeping on and understanding more and more about it. Somebody asked me, Doc, why do you keep doing what you're doing? I said, because the older I get and the more that I know, the stupider I feel. And I've got to learn more so I can help all of you do the things that you need to get done. But listen, it's really all about, understanding the pathway. So we're going to talk about these 500 million neurons, which connect the the gut and the brain together. We're going to talk about, how the body favors actually with the brain. One side over the other is connected. We know the right side is emotional brain. We know the left side is the objective brain. But does it have anything to do with anything else? And I'm here to tell you it does. And wouldn't that be fun? I'm going to do that on the 10th. I will put that together. So, hey, listen, you want to get smarter on the left side of your brain? You want to learn things a little easier? I'm going to show you how to make that happen. We're going to touch on those things as well. It can make a huge difference on anything that goes on in your body. So we're going to talk about, the gut-brain connection, and it's important that you really get it, that you really understand it, that you have control, particularly in this field. So join me as soon as we're done here on Dr. Tom Roselle Live, and we're going to go to Dr. Tom Roselle live stream, Ageless Health live stream. Go to drtomroselle.com. It's drtomroselle.com, drtomroselle.com. There's going to be a screen that's going to be sitting there. Just click in and we'll get started with that program. We're going to talk about your emotional makeup, if you will, and why you feel the way you do, the depression, the anxiety, how they're all interconnected, and make a difference for you. And it's a nice thing about the live stream. You get to see me. I'm sitting here at my office at the Roselle Center for Healing and kind of putting this all together for you. And it's my favorite place in the world. I think it's my home. If you ever have met me and we walk down the hallway, I shake your hand and say, "Welcome to my home." It's because this is where I'm supposed to be. This is me being in the place that I can help you achieve the best that you can be through your health, through your approach, through your focus, through your attitude. And we continue doing this on an ongoing basis, putting all the pieces together. But this gut-brain axis, how it's interconnected to your microbiome, how the body feeds back to the brain, how it causes so much strengthening or depletion in your immunological system. We're going to really get into that, because here's the piece that you have full and total control over. And if you don't get it, you don't understand it, you're never going to be able to help yourself. You're never going to be able to turn things around. Impossibility. Not going to work. So I'm going to give you the tools on the 10th. I'm doing the program. And you know me. I'm going to show you. I'm going to demonstrate. I'm going to tell you what you can do about it. I'm going to make all the pieces go hand in glove. We're coming up to that part of the program where, I got to say, make sure you join me in just a couple minutes. We're ready to go. Remember, I do this every Sunday for one reason only. I love you all. Don't go away. Join me. I'm going to live stream right now.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Hey, everybody. Welcome to Dr. Tom Roselle, Ageless Health live stream. And I got a great program for you today. We're going to kind of get into the mix of why we feel the way we feel. And it has a lot to do with your intestinal tract. And we're going to touch upon that a little bit and just kind of give you kind of a hand in glove on a lot of different pieces of that puzzle, whether it's anxiety, whether I just don't feel good, whether you're over the top, you're scattered, you have an ADD problem, so much that comes from the gut. And once you understand that people from all cultures for generations and thousands of years really understood those pieces when it came to how we react, how we respond, how we do the things that we do. So you look around and you see people at different levels of calmness, I'll use that word, or different levels of, oh my God, or fearful patterns and so forth. Where does that come from? Are they destined because it's a genetic tie-in over a period of time? Well, we know that anything that we're exposed to in an epigenetic format can give us that, predisposition. But does it mean that we're stuck with it? Does it mean that if we do the things the way we're supposed to do we have those experiences? The truth of it is, no, it's not. We talk about the intestinal tract with its microbiome. That means the good bacteria, the bad bacteria, the different things that live there, even molds and so forth. We know that there's a balance that needs to continue to be maintained. Otherwise, we end up with immunological reactions. So that's what we're going to talk about today. I want you to really get that your emotional platform often has direct tie-in to what's going on in your gut. Take a look around right now, and see all of our friends and neighbors and family members and so forth, and they react to all kinds of things. If you listen to me lecture, I'm going to talk about the talking heads and the people that make us respond the way that we do because we listen to them all the time. But more importantly is, do we respond differently today than we did years ago? Are we more susceptible? Are we primed more than we used to, be set up for? The short answer is, I think so. And there's a lot of reasons for it, but we're going to pick on one, and that's that food tube. That's what starts here and goes all the way down and exits out the other end. But I want you to think about this first. When you look at cultures around the world, you look at the Indian cultures from India, you look at the Chinese cultures, you look at the American Indians, you look at all those things. They all understood that what happens in the intestinal system has a tremendous effect outside that system. So let's take energy levels, right? And for some of you say, oh my God, he's talking about, some weirdo stuff. Not really, because in today's world, the modern definition of mysticism is science. And I had to steal that from a man who I have a tremendous amount of respect for, and that's Dr. Joe Dispenza. But we're able to program, we're able to repeat, we're able to measure, we're able to identify in today's world that we couldn't years ago. So let's roll it back. There are energy centers throughout your body based on all cultural platforms, right? You have a lower energy center that controls your what? That controls your gonadal expression, your ovaries, guys, your scrotum and so forth, your uterus, testicles, all those things, the energy that goes there, and the hormones that it produces. They have their own neurological system. You have a whole bunch of nerves at the end of your spine, at your tailbone, called the ganglia of Empire. They control that whole area. But the one that I'm really interested in talking about today is the one that comes up just from there. That's called the second energy system, or the mesenteric area of your body. That's where all the intestinal system is. That's where your small intestine, that's where your large intestine live, and you have all these things. Now, what's so important about that? What's so important is that it produces about 80% of your neurotransmitters. Those are the little chemistries that connect everything in your body, that allow your brain to work the way it's supposed to, that gives you your fight-flight reactions, that kind of ties in, allows you to think properly. If you fix your gut, you can actually fix one or both sides of the brain. So say that you're over-emotional, that's your right side, right? If you're stuck in, you don't do anything because you don't like to do anything else except for mathematical conjugations, and you want facts. That's your left side of your brain. There's supposed to be a balance. There's supposed to be a harmony. The right side and the left side keep each other in a nice neurological, emotional balance. Now, okay, we know that exists. That's up here, but that's not what I'm talking about. We're talking about your intestinal tract. We're talking about your gut. See, when you're born and you first came into the world, you had within about, maximum about 60 days, you had good bacteria and you had bad bacteria. You had yeast, single cell, they're called mycelia yeast. And then the good bacteria and the mycelia yeast lived in harmony with each other because they were there in a specific balance that allow each other to, to live without giving us any problems. But if one or the other got out of balance, then all of a sudden we had symptoms that were related to that out of balance situation. And those symptoms can be anxiety, it can be depression, it can be hyperreactivity, it can cause all kinds of things to show up. So if that's the case, this microbiome is hugely, hugely, hugely important. So do we have control? Absolutely you do. But I want to talk to you about what it does. So that middle system, that gut, right? Remember, we all use the expression over a period of time, that gut feeling. I have that gut instinct. I have that feeling. That's what we're talking about today. Where does that gut feeling come from? Is it the brain? And that's, you're volitionally trying to do that? Or is it this system producing the levels of neurotransmitters that it needs to have so you become sometimes more intuitive, more expressive? Well, the truth of it is, yes, it's kind of both, but it's more in that lower abdominal area if it's not working the way it's supposed to. So if you're eating things that cause inflammatory reactions, particularly in today's world, our food is so adulterated, unless you're one of the fortunate people and you go out of your way to make sure that you're eating good, organic, clean, non-GMO foods. You're staying away from the sugars and the sodas, the abundance of black coffee, the black teas, the fast foods, the fried foods, the alcohol, the gluten, the additives, preservatives. All of those things have a problem because they cause inflammatory reaction. But if you're staying away from them and you're eating things that are non-GMO modified, if you're eating things that are grown organically, you're getting enough protein in your system, all of a sudden there's a harmony there that your body goes into that chill place, right? It's like, wow, I'm in a good place. This is what I want you to learn. I want you to learn that you don't need the drugs to suppress the emotional. You don't have to, you need the drugs to upregulate your system. How about that? A willingness to go do things, that motivation to get things done. That starts in the gut. If your intestinal tract is not working, you can't produce a neurotransmitter called dopamine that will work on your brain and express your motivation. Did you know that not enough dopamine and you don't care about sex? How about that? Will that motivate you to do something about it? Well, that's part of the deal. You have to have a balance. Some people seem to be impervious to certain things. Some people are, have to deal with, overwrought situations. But let's get into this just a little bit. And I want to explain to you some of the things that you need to know about your feelings and really what's going on. Our emotions are connected to our gut. The gut-brain connection is critical. That system there has a very special name. It's called the enteric nervous system. And it's in our gut, right? And it gives us our anxiety. It gives us our stress. It gives us our anger. It gives us our sadness. It gives us our happiness. It gives us the emotions that we wouldn't think are being managed by something called our microbiome, the good guys in our gut. And it's not just going out and taking acidophilus. It's not just going out and say, oh, okay, I got to get a little acidophilus and some bifidobacteria. Those are important. We have to have that, and that helps us, and that helps protect us. But we still need to understand the other elements, why things are being broken down. How many of you have had at least 2 or 3 or 4 or 5 antibiotics over a period of years? I would gather to say a whole bunch of you. How many of you had vaccines and that have adjuvants in it? And what I mean by adjuvant, they're stabilizers, preservatives. What do we mean by that? Aluminum and mercury are the most common. They're going to cause a problem in your gut. And not only that, but they'll go in the nervous system. They'll attach themselves to the interconnected pieces within the nervous system. So you can't transport anything. So pretty soon you go to the doc and he gives you more and more junk, meaning
mood altering chemistries, or you figure you got to have that glass of whatever it is at nighttime every night or two, or you have to have that weed that you want to, calm your nerves down with, and you think that it's making you better than who you are. Well, how about understanding what really takes place? The emotional impact on the gut and the gut emotional impact on our expression of feelings is documented, and we really have to understand why it is. How about, you go do something and you feel like you want to throw up, right? You're scared, you haven't done it before, that emotion takes over. That's your intestinal tract, my friends. That's the thing that's triggered, and it's a communication back and forth from the brain to the gut. And if you understand that, then maybe if learning how to control some of the chemistry of that intestinal system, you can do quite differently relative to those emotional expressions. So, we want to understand that even traumatic things, there's a memory pattern that is recorded there. There was a study that was done at Columbia University a few years back, and what they saw is that a lot of the emotional stuff was stored in the intestinal system, and things like, grief and anger and the like. Now, you start looking at the yin, yang, positive, negative, the interacting balance of the coupling things that happen in our body. Let me give you an example. So if you have a grief pattern and you can't get rid of it, or something shows up and you don't know why you seem to be grieving, we usually think that's a recording of something that took place over a period of time in our emotional brain. That's called the limbic system, by the way. And there is a connection, but could it be triggered from someplace else? The short answer is yes. In Eastern medicine, there's a relationship between the large intestine and the lung as far as yin and yang. What's the connection emotionally? Grief. So if you see somebody walking around and they're sighing all the time, like that, it's going to be one of a couple things, and one will lead to the other. They're either dealing with an unresolved grief pattern that they haven't been able to let go of, that they keep holding on to, they haven't resolved and gone on, or they have a bad large intestine that's associated with that lung pattern. A lot of people who have physical problems, it's the opposite that they have to deal with. Somebody who has gluten sensitivity, for example, can end up with lung cancer. Somebody who has exposures to fumes and perfumes and smoke and so forth ultimately can produce a bad gut, and then the emotion that goes along with it. So what I want you to understand is that nothing is independent in your body, but particularly when it comes to your feelings and your emotions. And when you get that, that gut feeling of things, you got to be careful. The reason that you have to be careful is it may be misdirected because your intestinal system is in a bad place, meaning that you've been dumping all kinds of garbage in there for so long that your microbiome is not working the way it's supposed to. Subsequently, if that's the case, if that's the truth, then you got to do something about it. You got to quit going to the doc for the drug. You have to understand that you might actually have control over this. And, have you ever gone on and gotten any kind of coaching or counseling or anything like that, and it just doesn't seem to work the way it's supposed to? Sometimes you have to look inside and find out what is the neurochemistry that you're dealing with. Is it normal or is it not normal? Now, interestingly, on July the 10th, coming up at the Roselle Center for Healing in Fairfax, I'm going to be doing an evening on gastrointestinal problems, gluten sensitivities, things of that nature. And we're going to talk about these things. I'm going to show you how they manifest. So we're going to talk about what happens. So register for that. please make sure. And by the way, I'm doing that class, and it's just me and you, and we're going to really get into the nuances of these things. So I'm going to give you a lot of data. Come prepared to take notes. You know that I demonstrate and I show and tell as I'm getting things done. I'm actually going to do a program that I teach doctors who are in the integrated or natural healthcare arena, and I'm going to give them or give you what I give them, and things that you need to know about, things that say, I didn't know that. Why am I wasting my time doing these other things? Well, we're going to talk about that emotional platform. We're going to talk about what you can do about getting things straightened out a little bit and making a huge difference in your life. And by the way, while I'm on the subject and tell you what's going on at the Roselle Center for Healing, I want you to also put it on your calendar. And I think it's coming up on July the 21st. It'll be a Saturday. It's from 11 o'clock, I think, in the morning until 3 o'clock in the afternoon. And it's a flower fair. And it's a Women's Day. It's only for the women, guys. So you stay home. This is not for you. Ladies, this is for you. Dareth Painter, who's our thermographer, life coach, and she deals with flower essences and so forth, and the rest of our female staff have put this program together just for you. And we'd love to have you. It's an open house. The energetics we're talking about, remember, it starts from within. And what if you knew there were certain things that you could do based on, the essences of what's growing around you, the flower essences, if you knew what they were, could make a big difference, could really handle some of the problems that you're dealing with emotionally. So this is a spinoff of what we're talking about. So it's our first annual Women's Day, and we'll probably add some other pieces of the puzzle in. I think Dr. Stephanie Pina will be there. Dareth Painter will be there. Sybil McFarland will be there. Our nutritionist will be there. There's going to be a lot of people in and out. So learn about the benefits of organic facial products. We'll have those there. Learn about acupuncture and thermography as it relates to women health conditions. It's going to be fun. I won't be there. I'd like to show up, but I won't be there. They won't let me come. So, please take advantage of this, ladies. This will be a great, great event. Put it on your schedule. It's the 21st of July. And I promise you're going to have a great time. We're going to have all kinds of things there for you and to experience and to do. And you get to see this magnificent, beautiful office that we have here in Fairfax. So join us on the 21st. But let's get back to the emotional platform of feeling, if you will, and the experience that many of us have that we really don't know what to do with. There's some interesting stuff when you really start looking around and you see quotes that have taken place over time. For example, your gut is the epicenter, if you will, of mental, physical health. And if you want strong immunological function, then you have to start focusing there on gut health. So why is that true? We just said that your neurotransmitters that control your emotions there, but here's the other piece. Your gut also is 75 to 80% of your immune system, and that's from the microbiome as well. So if that's the case, and we really understand that, why can't we fix it, right? Well, we're going to teach you how to do that, and we're going to put that together. So the central nervous system, that's your brain, your spinal cord, and then the peripheral system is the 31 pairs of nerves that come off of that. And it controls everything that goes on with you. Your healthy central nervous system then produces a healthy gut function. Healthy gut function then produces a healthy central nervous system, and they go back and forth, back and forth. And so if you have an abnormal central nervous system, it's usually because you have an abnormal gut. You've been putting stuff into it for a long time because you know what? You ate the wrong thing. You went to the doctor and you said, here, take this and shut it down. Well, it starts very differently. It starts with what the consistency, what the balance of that microbiome is. And if you really understand that, you really get it, then you understand that everything from the way you are able to handle your environment without getting stressed out, the social interactions that you have that you're fearful of, the anxiety, the memory of past events that are not happy for you, they all go to your gut. And the gut also perpetuates that. So if we begin to clear the gut out, we stop eating the things that we shouldn't be eating. So the gut's no longer swollen. It's no longer inflamed. You know, that leaky gut syndrome. We're going to talk about that, by the way, on the 10th. So please join me. And I'm going to show you how to heal it. I'm going to show you how, you know, if you've got an emotional problem, you probably have pain in your body as well. If you have pain in your body, you have an emotional problem. And we're going to interconnect all those things. And if that's the case, and you can turn things around, once you want to figure out how to clean that out, next time you go for a soda and you think, is this affecting me? That maybe that you'll be a little bit more motivated to handle the addiction. So, you know, you have all of these things that happen hand in glove with the intestinal tract. And if you know it's there, and you know that they're related to each other, and you can get the tools to do that, it's time to study. It's time to really put this stuff together. So by adding a little hydrochloric acid, you know, to your system. So, you know, betaine hydrochloride, everybody goes out and tries to suppress the burn. But sometimes the burn is a result of not having enough acid. It's like the heavy alkalinity in your dietary patterns is the same as the heavy alkalinity in the garden. It burns out your vegetables. So if you know how to balance that by eating properly, getting enough clean meats that are not vaccinated, meaning the animals that you're getting the clean foods that haven't been sprayed with glycophosphates called Roundup, you know, eating things and drinking things that don't have sulfites to balance them out, getting rid of the heavy metals that might be in your body that may be causing some of this. All of this stuff can give you that emotional problem that we're talking about. So if you could, wouldn't you want to, wouldn't you want to listen to your gut? Wouldn't you want to go with your gut feelings and knowing that it's right? Or are you going to play this silly game forever? If you genuinely feel in your heart and soul that something is wrong, go with it. Understand that you owe it to yourself to begin to resolve the problem. If you know it's not right, probably isn't, but somebody else is telling you that it is. But because your gut's all screwed up, you don't trust yourself. You don't trust that gut feeling. And just remember, some of the best advice you'll ever get is by listening to that gut. But if it's not working, the information could be bad. So what are we going to do to fix that? Let me give you some tips on how to put that together. All right. Number one, eat slowly and only eat good quality foods. Today's world, it's very expensive to get the right kind of foods, but do the best you can to eat organic foods when you can get them. Stay away from meats and other products that come from the farm that have been injected, that don't have the things in them that you want to. They have either steroids in them, or they've had antibiotics put in them, or they're fed a ton of corn. And that's where you put on the fat, by the way. You know what they do? Even when they say that grass-fed, if it doesn't say 100% grass-fed, then the last 30 days, what they're doing is they're feeding the cattle corn to fatten them up. And that's why you get fat, because you're eating the outcome of that stuff. So if you can make some changes, you take a good natural probiotic that is multidimensional. If you can't, if your doctor doesn't prescribe a hydrochloric acid precursor, it's called betaine hydrochloride, then what can you do? Get a little bit of apple cider vinegar, and then twice a day, do about 2 tablespoons, a little bit of water, and slug it down. That acid vinegar actually turns to an alkaline ash in your body and helps protect you. That's a start. So between a good probiotic, doing something like that, stopping the garbage food that you're putting in your system, making sure you're getting good cooked vegetables. You know that silliness that they're talking about today that's called exocrine pancreatic insufficiency, that tells you your pancreas is not producing the enzymes it should. Well, it's a real thing, but we've known about it for years. The thing of it is, you don't need the drug. You can fix it yourself. Those are called proteolytic enzymes that you need in your body. So get yourself some proteolytic enzymes, take them after you eat. Those are things like amylase and bromelain and that family of things. So do that. Help yourself. It won't hurt you. I'm not going to tell you to go take betaine hydrochloride because it could burn you. And if you're on any of the suppressors, not the bisphosphonates, but the protein pump inhibitors, they stop the production of hydrochloric acid. And you go take hydrochloric acid, you're going to burn like crazy. Why? Simply because of the fact that you no longer have the protective coating around your stomach to make sure that you fix that. So we're going to do that for you. We're going to show you what can get done. We're going to show you how to fix it. Join us on the 10th. But pay attention to the program because we're going to get into this. So I've already given you several things that you can do to make a huge difference for yourself. And we're going to continue to give you the data simply because you deserve the information. And don't forget, July the 21st, we're having a Women's Day at the Roselle Center for Healing. Please join us. It's going to be fun. I won't be able to meet you because I won't be here, but you're going to meet some amazing, amazing staff members that really know their stuff. They understand the flower essences. They understand the cosmetics that are natural. They understand, all the pieces. Dareth Painter is probably one of the best thermographers that you're ever going to walk into. She really gets it. She works hand in hand with a group of physicians. She takes a look at things and then she, sends them out to the docs. We get the reports back very, very rapidly, like in a day or two at the most. And she'll give you some thought processes. She'll give you the result of her experience over 17 years of her doing this. I owe it to you, ladies. Join us on the 21st, and everybody else join me on the 10th, and that'll be the night that you just get me. And we'll start adding little pieces. Continue to watch us. Remember, Ageless Health live stream every Sunday immediately after I do the radio program on WMAL 105.9 in the Washington metropolitan area. And it's an FM channel. Join me. So we go from there to here. And remember something. I'm going to continue giving the data. That's the right data. That is the things that you need to know about. And remember, I do it only for one reason at this point. I love you all. You have a really great day, and I'll see you soon. Bye.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Digestive Disorders, the Gluten Connection and Immune Response on Wednesday, July 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.